If you knock out a tooth while playing sports, it can have devastating effects on your smile and overall oral health. Knowing what to do is crucial. At the same time, it's important not to let the fear of dental trauma keep you out of the game. Nearly a third of adults say they're afraid of getting a tooth knocked out, more than breaking a bone or tearing a muscle, and more than a third say they actually avoided sports for fear of getting their teeth knocked out. Dr. Craig Hirschberg, president of the American Association of Endodontists, joins us now to talk more about the survey. Good morning, doctor. How are you today?
I'm great. How are you?
Oh, I'm doing well, thank you. So what did your latest survey reveal about people's fears of sports-related mouth injuries?
Well, I think you already cited a couple of the stats there. You know, we were really surprised to find out that many people were avoiding sports out of fear of knocking a tooth out.
Well, what are your tips if someone has a tooth knocked out?
Well, if you knock a tooth out, you should bear in mind that time is of the essence. So we'd like people to attempt to put that tooth right back in the socket as soon as possible. So whether you sustain the injury or you're assisting somebody, just shake that tooth free of debris and just try to wiggle it right back in the socket where it came from. Now, realizing that some people are unsuccessful doing that, or maybe it's outside of somebody's comfort zone, in that case it would have to be done by a professional. It's really important that you try to keep that tooth moist for as long, get it into a moist environment immediately. So the best thing you could do would be to place it into a container of milk, and the colder that milk is, the better, and then transport the tooth and the patient to an endodontist, to a dental office, or to an emergency room, and make sure that tooth gets placed back in the socket.
So explain the difference between an endodontist and a general dentist.
Well, an endodontist is a dentist that's had a minimum of 2 years of additional training in advanced endodontic procedures, and root canal treatment is an endodontic procedure. Also in advanced pain control, and you know, there's a lot of technology that an endodontist would have in their office that may not be available in a general practice. And important to note too that an endodontic practice is set up in a manner that they're accustomed to accommodating emergencies on a you know, in short order. So if you were to call an endodontist after having sustained dental trauma, or maybe if you have a toothache, chances are the response is going to be come right over.
Where can we go to learn more?
So a good resource would be our association's website, which is AAE.org. And there's an entire area that deals with patient information and patient questions. And also, in the event of a toothache or dental trauma, you can utilize findmyendodontist.com and access a database that can allow people to refer themselves to an endodontist.
Thanks for sharing this with us today.
It was my pleasure. Thank you.
With the